Good.
Hi guys, this is Dr. Phil from Total Performance Physical Therapy. I'm here with one of my favorite patients, Chris. Say hello, Chris. Hi everyone. Today we're going to go over a mobilization with movement technique to improve dorsiflexion. One of the things I'm passionate about is manual therapy. I do manual therapy on all of my patients. I'm a certified Mulligan practitioner, so I use a specific set of techniques to help patients improve their range of motion, their strength, their function. A little bit about Chris. He is coming off of Achilles surgery, so he has been in a boot for a while. So what happens when you're in a boot for a long time is you obviously have lack of motion in that joint, in his ankle joint. And one of the things that can happen is from lack of movement, those small little bones and articulations and joints in the ankle can get stiff, and bones can not move as efficiently as they used to. And what I like to do is a mobilization with movement technique to help improve the function of the joint in his ankle. So if we slide over here real quick, what you can see is my crude drawing of an ankle joint. So right here you have your tibia. This is your fibula coming down across the tibia. And then here you have the talus. This is the bone we're going to be working on. And you have your calcaneus. These other bones we don't really need to worry about that. So with the talus and the tibia will articulate, or they touch each other when there's motion here. So when you dorsiflex, that's when you bring your toes up. And if you look at my foot, it's when you bring your toes up like that. That's dorsiflexion. Sometimes being in a boot, this can become stiff. One of the reasons why is that this talus may not move like it should, and it'll limit dorsiflexion. So what happens when we dorsiflex our foot is this talus will roll and glide back. So what we're going to do is I'm going to apply force to that talus to help it glide back as Chris leans forward to get it to roll in the direction that it should. The reason why this is important, if you're walking, it's very important to have full dorsiflexion so that when you're standing up and taking that step forward, you're not limited and you don't have that limpy gait that you can see people have when their ankles are stiff. So hopefully this kind of makes it clear. Again, these are the bones we're really focusing on in here. How the talus moves on the tibia is what we're focusing on. So let's go ahead and demonstrate this. Chris, you can come here and put your foot on this stool. So he's on the stool, the foot is flat on the stool, and what I'm going to do is put this belt around myself and around his leg. And what this does is it helps me guide his leg forward as he leans forward to dorsiflex his foot. So once I have good tension on the band, I want to make sure it's snug. And I'm putting it right at the tendinous junction of his Achilles and his calf muscles. So now I'm looking for where the talus would be. So I'm looking for his medial and lateral malleolus. I'm thinking just underneath that. And right here is where the talus would be. So I'm putting the web space of my hand right into that talus. So what I'm going to do is apply a posterior glide, because that's the way the talus wants to go when you dorsiflex your foot. So I'm going to apply that glide. Now, Chris, you're going to go ahead and lean forward. I'm using my weight to pull him forward. And when he's in here, I'm just going to give some little mobilizations in that posterior direction. I like to do 10. And then we'll go back. I maintain that glide. And then we relax. And I like to repeat this for 3 sets of 10. So I'm going to apply that glide once again. Here's a posterior glide. Chris, you can come forward. I help him come forward with the belt. And I maintain that glide, and I also add mobilizations in that posterior direction so that that talus gets moving. And relax. And we'll do it one more time. Chris, you ready? Here we go. Try to lean forward as far as you can. Perfect. And here we go with the mobilizations. go ahead and sit back on the table for me. So now that we've done that, if you move your foot around, how does it feel?
A lot better.
Does it feel looser than when you came in?
Definitely.
And when you walk, do you notice that you're walking smoother?
Yeah, much smoother.
More normal gait?
Yep.
Excellent. So you've heard it from me. You've heard it from one of my patients. This is one of my favorite techniques to do if somebody's having range of motion issues with their ankle, especially coming out of a boot. So if you know anybody or you yourself are having problems with any kind of motions, please give us a call at Total Performance Physical Therapy. I'm Dr. Phil. Have a great weekend.